So I'd like to introduce Dr. Ash Soni, who's a UK and US trained plastic and reconstructive surgeon and the founder and owner of the Soni Clinic, located in Ascot in the UK and at the Langham Hotel, London. Dr. Soni has trained at top worldwide institutions, including Imperial College London, Cornell, Johns Hopkins, and the Royal Marsden. He focuses on both the surgical and non-surgical procedures in his practice. Dr. Soni has authored more than 40 peer-reviewed publications and has also been featured in Vogue, Forbes, Tatler, Harper's Bazaar, Marie Claire, and ITV, to name a few. Now, I know that it's really trending on social media, the salmon sperm facial, they call it. I know you've had years of experience using it. You were one of the first people to use it in the UK. So first of all, let us know, what are salmon sperm facials, or as I like to call them, polynucleotides, and why are they beneficial for the skin?
Yeah, so firstly, I just want to say a huge thank you. It's an absolute honor to be on your incredible beauty channel, so I really appreciate it. And let's dive straight in. I mean, salmon sperm facials, as they call them. I mean, obviously the word facial isn't strictly correct, as you know, because it is an injectable procedure. So there is some element of minimally invasive, because you're putting a needle underneath. So I just wanted to clarify that. Now, I think salmon sperm and polynucleotides, as you rightly said, they have really taken the world by storm, and we're seeing this all over every headline. I think every media piece I've pretty much written within the last year and a half have been focused purely on this. So everyone wants to know why they are so great. Now, I think if we take a step back and we look at the aesthetic industry as a whole, there's so much stigma associated with certain injectables. And you think about filler in particular, a lot of the celebrities, a lot of people in the media are kind of seeing the worst results out there. And I think now the trend is moving slightly towards the more natural injectables. Like, how can we boost on a cellular level certain things that we lose with age? And that is exactly why something like polynucleotides, or the salmon sperm facial, as they're calling it in the media, has become so popular. So just to summarize, and we're going to get a little sciencey today, because I know your channel does focus on like the actual ins and outs of things. But salmon DNA itself is actually very similar to human DNA, and evolutionary has been shown in vertebrates the similarity between the DNA within certain types of fish, including wild salmon, and humans. And actually, when you take those DNA fragments and you look at, number one, the number of genomes down the helix itself, it's actually very similar and resembles human DNA. There's quite a lot of overlap. So you're looking at this biostimulation effect when it's injected. And the purpose of it is really to stimulate collagen and elastin production, as well as many other things. So we're really helping with that aging process. The benefits are to help with the quality and health of the skin, which I think is something that we're all looking for now.
I think you touched upon a really important aspect when it comes to how we look, especially if you're over a certain age, maybe over 45, 50, depending. Like, I'm almost 50. I find that fillers, especially used on older people, you tend to look puffy. You tend to look not your best. It looks sort of nicer on younger skin, but it doesn't look so good when your skin has a little bit of laxicity to it, especially under your eyes. I see so many people that have had under eye fillers that looks like clouds, and you look puffy, like you didn't really get a good night's sleep. So what are the alternatives to that, especially when you're at a certain age and you don't want to end up looking puffy? There are, of course, surgery to tighten, you've got lasers to tighten, and you've got these polynucleotides, or salmon sperm, which I find that the results from these salmon sperm, again, it's not facials, they're really injectables, just are outstanding. So that's something that I think everyone should know about, that it's really good results. But I want to also ask you, because I know, what is the difference between Profhilo and this salmon sperm injection?
Yeah, it's a great question. I think that's a commonly asked question now. And I think Profhilo falls under the family of skin boosters. So Profhilo is a brand name of a particular type of skin booster essentially. And the reason why everyone knows the name Profilo is because they did a great job at marketing from early on. So it became a brand name that everyone just associated skin boosting with. Now, the Profilo itself as a skin booster can only be injected into a few points, and actually 5 points on the face on either side. And so the difference between something like Profilo, which is a skin booster, and polynucleotides is that Profilo simply are hyaluronic acid based. So they're really good at hydrating the skin, giving the skin a little boost and not drawing in too much water, right? So whereas polynucleotides actually, in my opinion, from an aging perspective, actually do a lot more than that. So polynucleotides are stimulating one main receptor called the adenosine A2A, and I know you love your science, so it stimulates a particular receptor. And by activating that receptor, it then stimulates this chain of metabolic and cellular pathways. And the goal really is to increase the number of fibroblast cells, which, as you know, are the cells responsible for your connective tissue, like your collagen and elastin. So when we're looking at a quality and health of the skin, we're looking at how those fibroblasts are functioning as we age. And we obviously lose that as we age, and we lose collagen and elastin with age. So we lose that elasticity and that bounce back to the skin. And so I think from that perspective, polynucleotides are helping with that. They've got an antioxidant effect, so they're brightening. They've also got anti-inflammatory effects. They help with pigmentation. So they're doing so much more than just skin boosting or hydrating, that the comparison is just such a different thing now. And I think when people are looking at me, and you mentioned, people who are aging, especially women, which is very high in my practice, as you know, like I have a lot of patients between really 40s all the way up to 80s for injectable treatments. And the goal is really to help them through that process where normally they're losing that collagen very fast, and giving them an alternative that's natural, that's not changing their face in any way. It's just boosting it and helping them with that aging process.
I think then, in a nutshell, we can say that the difference between Profilo and the salmon sperm injectables is that Profilo is hyaluronic acid based and provides hydration, right?
Correct.
However, salmon sperm injectables provide hydration. They actually help your body produce more fibroblasts that produce more collagen and elastin. It has anti-inflammatory effects, and it has brightening effects.
Exactly.
And as you said, when for older women who want to look better in a more natural way, when you inject fillers, you're actually not helping the body help itself or helping the skin help itself. You're just injecting a filler that may or may not stay, may or may not help your body produce more collagen and elastin. But here, with this salmon sperm injectable, you're injecting it, and it's actually helping your skin behave in a much younger fashion, where it's not producing as much pigmentation. Age spots, there's a reason they're called age spots. You're helping your own skin produce more collagen and elastin producing cells. Just one question, two questions I have. Is Profilo and salmon sperm injectables almost the same price? Are the prices similar? And can younger people get salmon sperm inject? Who is it for? Who is it best for, results-wise?
Yes, some great questions. So from a cost perspective, it's very, very similar. So actually, skin boost and polynucleotides are almost the same price in my practice. You're really paying for, you know how the industry works, but you're essentially paying for the quality of the product, the amount of product that may be needed during those, multiple 2 sessions, and we'll get into that, as well as the quality of the provider. So very, very similar prices from a cost perspective. In terms of how often you do them as well, which is important to know, very, very similar as well. Around 6 to 7 months is kind of to kind of keep it maintained. From a perspective of young, it's really interesting about this, because I'm talking about a lot about this in the media, about whether young patients and the preventative element of some of these injectables. Now, I don't treat in my clinic very young patients in general. I don't think that patients in their young 20s have really any need to be undergoing some of these injectables that some clinics are doing. However, the advantage of polynucleotides is that they are safe, and because they are a natural injectable that are simply boosting all of the things that we've mentioned already, from a collagen, elastin, brightening, there's really no downsides to injecting. although you just have to consider that it is an injectable treatment and the risks of any injectable treatment is always there. I think the youngest age in my practice that I've injected polynucleotides is probably low 30s, and I think that's appropriate. As soon as they start losing that collagen, they start noticing some fine lines, and we're all genetically, we're all made up slightly differently. Like some people just start having more creases, a little bit of elasticity a little earlier sometimes. And I think it's totally appropriate in that situation to then treat with polynucleotides. And the other advantage with polynucleotides, just before, sorry, we jump on it, is actually that there's no downside to injecting it more frequently too, because it's not a volumizer. So you're not at the risk of, drawing in too much water or making people puffy or overfilling with certain other things, as we've mentioned. So it's actually the nice part. So some of my patients want to stay, super fresh and really boosted, and they can come every 3-4 months, and that's totally acceptable.
I think fresh is a lovely way of describing how your skin looks like when you're on polynucleotides. Now, one question I keep getting, and I know you've sort of told us, why salmon sperm? I know you said there are similarities, but are there animals that have more similar sperm DNA to us? And why salmon? Just if you know.
Yeah, it's interesting. So actually, it could be either. So out of polynucleotides in general, most of them have been studied on either trout or salmon DNA. Now, when you look at vertebrates in general, and this goes back to like evolutionary data, there's always been shown to have a lot of similarity between like certain zebrafish or certain types of fish and humans, much more so than some other mammals that we could assume that we'd be closer linked to. And now, if you take out of the fish DNA and wild salmon specifically, and I say wild salmon rather than farmed salmon because actually wild salmon are constantly adapting to a changing environment, just like humans are. So actually, when you look at their genetic makeup, it's more similar to humans because we're constantly adapting too. And that's why specifically wild. Now, these salmon, just, for people who don't know, they are not harmed for this treatment. They were actually, these are salmon that are sourced for the food industry from Alaska typically. Most of the big labs are in Italy, and the particular brand of polynucleotide that I use, their lab is in Milan. What they do is they basically extract the DNA from those salmon that were already being sourced for food industry. So it's not that fish are being harmed to allow people to have this treatment, just so that people understand exactly how it's happening.
Now, for all my US listeners, why isn't it FDA approved? I mean, it's safe, it's great. Why isn't it FDA approved? Do you know?
Yeah, as you know, any new or novel injectable just takes ages to get through the US system, and FDA are so strict about it. Do I think it makes sense for it to take this long to get on? Not particularly. I mean, you have filler and all these other injectables that are out there in the US. Skin boosters finally came into the US last year in a big way. So doesn't make a lot of sense in my opinion. However, it just takes time. And from speaking to some of these companies, it sounds like it may be up to a couple of years until they're able to finally be out in America now. As you know, Kim Kardashian, some of these celebrities have been talking about having these treatments done. I think either they're flying to another country or that people are getting hold of it kind of under the radar in America. But yes, you're right in that it's not FDA approved, but that doesn't mean that it's an unsafe product. It is completely safe. It just takes a while to get regulated. But we're luckily, me particularly, I have a lot of US clients, as you know, flying in for this treatment. So it's lovely for me as a clinic just because I have a lot of international patients flying in for it, but it will just take a little bit of time, but it will get there.
And I just want to say, just because it's not FDA approved doesn't mean it hasn't gone through approval processes in Europe
Correct.
and in the UK, which tend to be actually more strict
Correct.
than the FDA. So just because it's not FDA approved doesn't mean that someone else's or some other countries are lax in their protocols. Not at all. They're actually, Europe is more strict than the US. It's just
Absolutely.
for some reason taking so much time. Now, you touched upon this, that some people are getting it in the US. For me as client, I tend to like to go, if I'm going to go and get it done, to someone who has done it before. I don't like to be the experiment. I don't like to be with someone who hasn't used it for, years. And I know you've been using it since one of the first people in the UK. So that's another thing that I think, use your common sense as listeners, don't go to someone who doesn't use it or it's not approved in their country. Why are you know, they don't have a lot of experience with it, even though it's safe, it's probably easy. And another thing when it comes to injectables, and this is just in general, I wouldn't go except to a plastic surgeon and or a really good dermatologist. Why? I know that a lot of nurses are giving Botox and fillers and skin boosters and probably this elsewhere in Europe. But for me, it's about where you inject, isn't it, Dr. Soni? I mean, the results
Absolutely.
are not just what you're injecting, because there are many polynucleotides in the marketplace, you know, but the quality of what you're injecting and where you're injecting it makes all the difference. Your face is almost like a sculpture, and you need someone who understands. We've all studied anatomy. I'm a medical doctor. We did face and neck anatomy. I cannot say I know more about, you know, where the muscles are and where the nerves are and the differences and the variations that happen. Not everyone has their nerves in the same place or their muscles in the same place. There are variations that happen in the human population, and people like plastic surgeons know it. I mean, I think you see me as, you know, muscles and nerves and everywhere. So I think, like you said, it's not just what are you injecting, but also who's doing it for you that give you great results. Just a question, are there any studies, any data done on polynucleotides to show that they do increase the number of fibroblasts and et cetera, et cetera?
Yeah, actually, polynucleotides, even though they've come out in the world now as this new trendy treatment, actually, polynucleotides have been studied since the 1980s. So if you look at all the way back to the 80s, were studies in that time, they could obviously do mice studies, right? So like a lot of the labs there would study, and it was mainly studied actually for tissue regeneration. So that was pure, that was the science that polynucleotides has originated from, because what they did was they got certain agonists of this particular receptor, and an agonist means that it stimulates that receptor for people who don't know. So it's basically a compound or something that will actually stimulate this particular receptor, and then they can see by measuring markers what the chain of events are from that. And what they found in the 80s was that it was actually speeding up wound healing in these mice. And they had like diabetic mice with chronic wounds, and showing that by stimulating this receptor, it was regenerating. And skip to the 90s, plastic surgeons started using this agonist to actually pre-treat chronic wounds as well in humans. And then around 8 years ago, started being studied in Europe in a big way in the aesthetic industry. And they realized that by the stimulation of this receptor, you're getting the collagen, the elastin, the brightening, and all these other things that we've talked about today. So actually, there's a lot of data on the science of this particular receptor, how it works, and the effects of it. So even though it's now seen as this trendy thing, it actually originates from science from the 1980s.
It's good to hear, because there are so many, especially when it comes to beauty and cosmetic procedures, people just jump on the bandwagon and not realizing that it's an extremely new procedure and we don't know, we don't have enough data. But with the salmon sperm injectables, it's nice to know that it is safe and it has data, and people have been studying it for more than 3 decades.
Yeah, yeah,
Yeah.
yeah.
So
It's pretty
a
amazing.
question. I mean, it's something that I think that a lot of people, especially of a certain age, should really look at. It is something that you will love the results, and the results are your own cells producing the collagen and elastin. And I think that's a really important differentiation. I think we've said it again and again and again, but let me say it. The salmon sperm injectables help your own cells produce collagen and elastin, and anti-inflammatory and anti-pigmentation as well, brightening, hydrating. But it's just really important, so you end up looking like yourself but better. I know we've touched upon this, like who should get it. You said anybody who needs it. Who should avoid it? Are there any people that should avoid it?
Yeah, I would say anyone who's pregnant or breastfeeding. That applies to any injectables. I think you've always got to have a thorough medical consultation with your provider. Make sure that, everything about your medical history is in check with any injectables that you ever go. But I think the main true contraindications are for patients who are pregnant or breastfeeding. Otherwise, the beauty of polynucleotides is they can really be, to be administered to a really large group of the population.
So, what's the skin profile of the ideal candidate? Because I'm an integrative medical doctor, I like to think 360. So, here you are spending and getting injectable polynucleotides, hopefully with you, because they'll be so happy, I can tell them.
That's it. Thank you.
But so, your cells now are producing more fibroblasts, producing more collagen, more elastin. Do you think it's worthwhile for people to also give their skin the building blocks it needs to produce proper collagen, proper elastin? Because we know the major agers or things like sugar can sort of interfere with the proper cross-linking of collagen, elastin, and not making it so bouncy. Instead, it's a little bit tight. So I'm not saying you have to, but what I would say is if you're going to get these injectables done, just make sure that you're taking in good collagen, that you're taking in enough vitamin C, lots of fresh fruits and vegetables. We know food first, but also keep your maybe sugar levels less if you want that springy collagen, since your body's producing it anyway. Because I know that you recommend topicals. Right, in terms of, and let's talk about the topicals that you recommend, which is basically face creams and eye creams, and what they have specifically, and why you recommend them after these treatments, and to be them.
Yeah, absolutely. I think, the skincare is, as the importance of this. For me, I describe skincare as if you go to a dentist and you're just not cleaning your teeth in between appointments. I mean, that for me is what skincare is, because if you're investing this much in injectables, you're trying to boost that collagen, improve that health, you really want to then complement it with good skincare. Now, there are certain brands, and we can talk about certain things within and ingredients, and then I can mention a couple of brands. I'm not sponsored by anybody, so there's no financial disclosures to note. But when you look at certain ingredients, firstly, you want to be on a really, really good antioxidant serum. I think that's number one. It will help with collagen synthesis, of course. It will protect against, and I watched a video of you talking about this, it protects against that free radical damage from the outside, right? From UV, from pollution, all these other things that we're exposed to. So really good antioxidant or vitamin C serum is critical. SPF, SPF, SPF. We're always hammering home about this as plastic surgeons or dermatologists or even doctors in general. The importance of SPF, even in the winter on a cold, dry day, it's still really, really important. And then you want to look at, there's now very novel peptides actually that have been developed that actually help with collagen and elastin synthesis. Now, there's a particular brand, I'm going to name it because I don't have any financial affiliations with them. It's a brand called Elastin. Now, Elastin is well known in America. It was recently, in the last couple of years, bought out by a company called Galderma, which is very well known in our industry. Now, Elastin have uniquely patented specific peptides that actually boost collagen and elastin synthesis and also recycle your old fragments of collagen and elastin that normally just sit there as a gelatinous waste in our skin. And so what it does is it has an enzyme, it breaks it apart, it recycles and creates a lovely, healthy skin bed for their new collagen and elastin and fibers to lay. And if you think about that technology and understand that, and then you understand what polynucleotides or even other collagen stimulating injectables like Sculptra or other things that we're doing a lot as providers, it complements it beautifully. And so there's really been a lot of innovation over the last few years within the skincare world, and I think you can really help yourself. And then obviously a retinoid, like a vitamin A derivative, and that can also really help with cell turnover and with collagen synthesis too. So I think you just want to speak to somebody who can guide you, because I feel like the skincare world is a bit of a minefield sometimes, and you don't really know what brand is good, and you have to just know somebody who knows their research. And I think that's what you're there for a lot of your patients for, and me the same.
And going back to the salmon sperm injectables, I'm just going to call it salmon sperm injectables, because if I say polynucleotides, a lot of people will think I'm talking about something else. I know that you have a particular protocol when it comes to injecting the first time. I just want people to know what your protocol is, because many of my clients, listeners can come and see you, but a lot of them can't. And therefore, they'll be comparing what other people do to what you do. And I think you're sort of the gold standard, really, when it comes to these injectables. So can you tell me a little bit about your protocol? Because I know you inject and then you wait a few weeks, and then you do a second injection, and then people can wait 4 to 6 to 8 months depending on their own skin. So if you can talk to my listeners a little bit about the protocol and why you do it the way you do it.
Of course. So typically polynucleotides, whether it's the under eyes, the face, the neck, the body, because polynucleotides can really be injected anywhere. But firstly, let's talk about that there's different concentrations of polynucleotides. So there's one that's formulated for the under eye, which is the lowest concentration. There's then a sort of a medium concentration for the face and for the neck, and then a slightly thicker one if you're doing areas like jawline, cheeks, or certain body areas. So firstly, you've got to go to a provider that you know is using a good brand, I think is number one. The way I space polynucleotides out is that you have to wait at least 2 to 4 weeks between sessions. Optimally 2 to 3 if they lived in your country, but I have a lot of international patients, and so can do it up to 4 or 5 weeks if needed. It's not a strict criteria, but how that's based is really based on the clinical data that we have. They've tested this in a lot of clinical populations, and basically over the years in Europe found that the best, most optimal way of doing this is one session, you wait 2 to 4 weeks, you do your second session, and potentially even a third if you need it. And then patients would probably need to maintain that anywhere between really 4 to 7 months to maintain those collagen reserves, because as you can imagine, you're building upon those collagen reserves, and as you continue to age and every year that passes, that collagen is dropping and dropping. So we want to be able to maintain that collagen within your skin to keep at a nice level so that it helps with that aging process. And especially the women in the audience who are listening to this, going through perimenopause and menopause, within those first 5 years of the perimenopause and menopause, you're losing 30% of your collagen. And that's why a lot of women, or often, and I have so many, my majority of my patient population are women going through this, and they always compare it to their husbands or their partners or people that they know or friends that they know. I think they always say, compared to men that they know in their life, they feel like they're losing that collagen a lot quicker. And it is because with the hormonal changes you are. And so there are ways now that we, certain injectables that we have and skincare that we talked about to really help you through that process. And I think it's really important. So that's how my protocol and the reasons behind my protocol of how I do it.
Now, you said body areas for polynucleotides. You did say that salmon sperm injectables you can inject in far more areas than something like a hyaluronic acid base like a Profilo. But body areas, where are the body areas that you inject in?
I have injected in quite a few different areas. So I would say,
and why?
So normally it's based on that aging skin, right? Because we're aging face, neck, and body. So actually, if you look at our collagen, whether it be, I've done people's elbows, I've done knees, I've done the décolletage, I've done upper arms, I've done quite a few different areas. People are using it a lot around the belly button area and the tummy area post kids, when patients are having kids and they're losing a little bit of that elasticity and that bounce back of the skin. So it really could be used anywhere. Obviously, there's the financial element to consider because they're not the cheapest things to have done. So you've just got to consider with your provider how much of an area, how large an area is it, and how much product would be needed for it. But it can technically be injected anywhere. I've done a lot for the hands as well, because hands now have become the area where people notice the discrepancy once they've been treating their face and neck for a few years. The hands are like the hot topic. Hands and neck obviously are the areas that people previously were neglecting. So you can do it really in anywhere to give that boost, to improve that elasticity and improve that quality of skin. So there's really nowhere that you can't do it.
I have to say that salmon sperm injectables, and I compare it to lasers because I'm very a big proponent of lasers when it's used the correct way. It really stimulates your own skin to help itself. But I have to say that, I like the fact that there's no downtime, and we can talk more about that, but really there's no downtime. You don't have issues with hyperpigmentation because of sun exposure post laser or post treatment, and it just gives your skin this sort of radiance and glow from the inside that lasers fall a little bit short on when it comes to that. So I think that there is a very, I think that in a few years, everyone will be doing that and they'll be doing maybe less lasers. What about pore size? Because lasers can take care of pore size. Let's talk about salmon sperm injectables and pore size. And then I want to talk a little bit more about something else.
Okay, sounds good. Yeah, so you brought an important point about comparing, like with lasers and things. I think lasers, if I'm being totally honest with you, I think lasers are overused in our industry. People are going for those laser facials. As you say, there is downtime associated with that, and I think the beauty of this now, obviously, it depends on your provider and the exact way that they're doing this, because I have a lot of I treat a lot of the beauty directors here in the UK now, and a lot of them who've gone previously to other providers, sometimes it depends on the way that they're doing the technique, which will mean whether patients will get more swelling or bruising. So there is obviously a technique base to it, but you're right that as an injectable overall, the downtime is much less than some of these other devices. It will improve pore size in general, and I think most of the collagen stimulating injectables do, some more than others. Polynucleotides do help with pores, it helps with that quality of skin. I would say Sculptra is another one. I know we're not talking about that specifically today, but Sculptra is another collagen stimulating injectable that significantly helps with pore size. So you've got many collagen stimulating injectables that actually do help with pores and that inflammation within the skin too. So it's a great point that you mentioned. I think comparing it to devices, you can really get such a beautiful result with actually having to undergo that true downtime.
And also people with dark skins. I am considered a very dark skin for lasers, and I know that lasers have come a long way, but people with very, very dark skins and cannot do any lasers, yet still would like something. This is great because if I am not mistaken, any skin tone
Yes.
can do it, and there's no downtime associated with it.
That's correct. That's correct. I've treated all of Fitzpatrick scales, like I've really have such a diverse group of patients, which is wonderful. And I've been able to see it and really, across the board, touch wood, I've not ever seen a problem with it, which has been really great.
So polynucleotides and hair loss, do you have any experience with the hair loss? Because I know microneedling and PRP for hair loss is something being recommended. Is salmon sperm injectables, is it something, we can use for hair loss, or are there better options?
No, I think that the world is moving slightly away, actually, especially in the UK. Like people are doing less and less PRP. Previously, a lot of people really knew about PRP and hair loss, and now I think the world is moving a little bit more towards polynucleotides and exosomes. I'm not going to talk about exosomes today. It's not something that I do in my personal practice. But regarding polynucleotides, there's a lot of data to show that it can stimulate follicular growth. Now, it has a number of effects when you look at it again on a cellular level. It actually increases the blood supply to the area that is being treated. It's called something called angiogenesis, which means that it's recruiting new blood vessels to that area, and it will do that in the scalp when injected. So not only is it increasing the blood supply, but again, some hair-related conditions are inflammatory, associated with inflammation. And so by bringing that inflammation down, by recruiting more blood vessels, there is a lot of evidence now to show that it can actually help stimulate hair growth. Now, if it's a particular condition that people have regarding the hair, then I will send them to a hair restoration expert, because as a plastic surgeon, yes, I've done a lot of work on hair and the scalp in my time, but I'm not a hair restoration expert and it's not my lane. So I will refer out in London if it's for something like that. But there's definite evidence. There's definite evidence for that.
Great. Well, I think you've been wonderful. You've answered all the questions. I think I've exhausted all the questions about salmon sperm injectables, and I just want to thank you. And if anyone wants to see you, they can go to @the Soni Clinic or the Soni Clinic. Just Google it. And Dr. Ash is based in London, and I personally will see you very soon as well.
Sounds amazing. I really look forward to it. And thank you so much for having me on. This was an absolute pleasure to chat with you today.
Thank you for your time, Doctor. We really appreciate it.
Thanks a lot. And no, thanks.